Hi, I'm Debby Farkas, Director of Educational Development at WISER. Today I'm talking about one of our newest programs, Radiology Simulation, or RadSim. Here with me today are the RadSim course directors, Drs. Alisa Sumkin and Michael Magnetta, and their mentor, Dr. Philip Orons. Dr. Sumkin, can you tell me what gave you the idea to run this course?
Yes, so the idea began from a situation that I went through when I was on a neuroradiology rotation about 1.5 years ago. I received a call from one of the techs in the MRI control room about a patient that was having difficulty breathing and having a little bit of tongue swelling. So being that this was very early on in my training and I didn't know where the MRI room was, I grabbed one of the attending physicians and we went over to the room together. We assessed the patient, and as we were doing so, the patient progressively developed worsening symptoms of difficulty breathing and tongue swelling. So we were able to obtain the contrast reaction kit that we have available in all of our rooms, and began to appropriately administer the medications that we are supposed to give for one of these reactions. Unfortunately, neither myself, the attending radiologist, nor the nurse that was present have ever opened one of the epinephrine boxes before. And these medications are different in the way that they are administered than a lot of other medications. So that made it more challenging for us to seamlessly flow through the treatment of the patient, and just took a little bit more time than we would have liked to. Okay. We realized that we needed to learn how to better administer these medications and just have a better idea of contrast reactions in general, from the level of the resident to the attending to the tech and the nurse, and that we should all be working together in order to best treat the patient. And that is when I realized that there's a real need for this knowledge, and we began this program where we set up a simulation for these contrast reactions so that we could all learn from them and better treat our patients.
Dr. Orons, in your experience, how have you handled these situations in the past?
Well, radiologists have been dealing with contrast reactions for pretty much as long as there's been iodinated contrast. And I think every radiology resident physician, if you ask us the basics of treating a contrast reaction, every radiologist can tell you what they are. But the problem is knowing things in principle and implementing them in practice are two very different things. And I think that's the problem that Dr. Sumkin ran into last year when she had a situation with contrast reactions. I've been involved with radiology education now for about 25 years, including 14 years as director of the residency program here. And even though we've had lots of training dealing with contrast reactions, they've all been presentations, there could have been online models that were done, but nothing where we actually had people physically go through the steps necessary to treat a reaction, and that's exactly what was done in the WISER high fidelity simulation. And quite frankly, I can't believe we haven't done this sooner, to be perfectly honest.
I think that's really the power of the WISER Center, is kind of helping us put together a course to treat these contrast reactions when we didn't really have the resources or the know-how within the department. WISER really stepped in there and filled that void and really helped us develop something that people in the department are asking to take, which is a change from, maybe in the past where you had to do an online module or sit through a lecture where you're a passive learner. People are more active learners in the curriculum here at WISER, which I found, the help that they've provided us and what they've helped us to achieve has been really, really positive.
I have to echo what Mike said a moment ago. It's true. I've never seen a time when people were actually asking to take an educational course. Usually when we ask our physicians or residents, our attendings to do some type of thing, something educational, you have to pull teeth to get them to do it and put deadlines in place, maybe even penalize them if they don't get it done. Here, we actually have people asking us, when can I take the course? When can I get into the center? And it's unprecedented.
Yeah, and WISER has really made it easy to get CME credits for the attending physicians, CE credits for the techs and the nurses, and just has been, facilitating that throughout the whole process. Made sure that we developed the course in such a way that we would qualify, and then actually brought us through the process with the office downtown. And so it's been a really positive experience.
That's great. I'd like to ask you a few questions about WISER's course development process. Were there some specific things we did that were really impactful to the success of your program?
Yes, definitely. A few things that I'm thinking about that were very important to the development of this entire course were, in the beginning, we wanted to create a module for the participants of the course. And we had no idea what we were getting into in terms of how people were going to receive it, were they going to like it, were they actually going to want to do this. So Dr. Magnetta and myself created this bare bones PowerPoint, which really only had the information that we wanted to get across to our target audience. Then, after that was done, we handed it over to the WISER staff, including yourself, and you all turned it into this beautiful masterpiece, which was very well received in the end. It was user-friendly and very interactive. It was something that I didn't even know could exist. So I was very pleased by that, and you all made it very easy for us. And then when we went on to the next part where we were actually creating the simulations, all of you gave us some basic points in terms of what we had to give you guys with just what the reactions were, the vital signs, and we briefly mapped those out, gave you and your staff the information that you needed for that. And then when we came back, not that much longer, everything was pre-programmed into all of the simulators and everything ran very, very well. I was so impressed, and the staff just was very good at this entire process, made it easy for all of us who had no experience in any of this kind of project beforehand. So I was very happy by all of it.
The three of us served as facilitators for the course. None of us had ever facilitated a simulation course before, had no idea how to do it. But your staff made it really easy to make sure we couldn't fail when we did this course.
And kind of going in that vein, the WISER staff helped us set the course up so that facilitators in the future can just drop right in with pre-programmed modules and the ability to just kind of let it run after some minimal training on how to use the software, which is really nice.
That's great.
Software is pretty cool too.
It was fun. So based on reading the feedback that we collected in our system online, as well as what you guys have just mentioned, it seems this course has been really positive. Have you seen any impact in the clinical setting?
Yeah, so I think that's probably the most important question to be asking is, are we having an impact when we go back to the hospital? One way to measure the impact is just to look at test scores, before and after the course, which did improve. But the other way is I was emailed by one of our residents who had taken the course, who was involved in a contrast reaction at Shadyside 2 days after the course had completed. She told me that the way that she approached the contrast reaction changed completely from before and after the course. She knew which dosages to administer at the appropriate times, who to call and when. And it really made the experience, it was transformative. And I think that, that's the power of active learning in the WISER environment.
That's great. Well, thank you all for taking the time to speak with me today. It's been a pleasure working with you, and I look forward to working with you in the future.
Thank you.
Thank you.
For more information about WISER, please visit our website at www.wiser.pitt.edu. You can also subscribe to our YouTube channel. Thank you for your time.